Amlodipine versus Losartan. Side effects. Which is worse for you? Every single day, a vast number of Americans find themselves reaching for a pill to manage their high blood pressure. Among the most commonly prescribed options are amlodipine and losartan. While both medications have proven their effectiveness in bringing down elevated blood pressure, the experiences patients have with their side effects can diverge significantly. One of these medications has gained a reputation for causing noticeable swelling in the feet and ankles, a phenomenon known as edema. The other, conversely, is frequently associated with a persistent, often bothersome, dry cough. If you've ever found yourself pondering which of these drugs might pose a greater risk, either to yourself or to a loved one, then this detailed exploration is precisely what you need. Before we delve into the specifics of each medication, it's crucial to establish the foundation of our understanding. Everything you will learn in this discussion is firmly rooted in meticulous research drawn from highly reputable medical institutions and authorities. This includes insights from leading organizations such as the Mayo Clinic, the Cleveland Clinic, the National Health Service, NHS, in the United Kingdom, and the Food and Drug Administration, FDA, in the United States. You will find comprehensive references to all the sources we've consulted conveniently listed in the description section below this video. It is of paramount importance to reiterate that the information presented here is purely for educational purposes. This video is not intended to substitute for professional medical advice. Always, without exception, engage in open and thorough discussions with your doctor regarding your individual health situation and any concerns you may have about your treatment plan. Today, we aim to comprehensively dissect the mechanisms by which both amlodipine and losartan operate within the body. We will meticulously examine the side effects that warrant close observation and critically assess which of these medications tends to contribute to more significant problems in the everyday lives of patients. Let's begin our in-depth examination with amlodipine. Amlodipine stands as one of the most frequently prescribed medications for blood pressure management across the United States. According to data from the Mayo Clinic, physicians prescribe tens of millions of prescriptions for amlodipine annually. It has effectively become a default choice, particularly for older adults, and especially for those who have recently received a diagnosis of high blood pressure. Amlodipine belongs to a broad category of drugs known as calcium channel blockers. While the name might sound technically complex, its function can be readily understood in straightforward terms. Calcium plays a vital role in the natural process of muscle contraction within our arteries. It helps these vessels to tighten and narrow. When amlodipine is administered, it effectively blocks calcium from entering the muscle cells that line the arterial walls. This blockage leads to a relaxation of the arteries, allowing blood to flow more smoothly and with less resistance. Consequently, this reduction in resistance alleviates the overall workload placed upon the heart, enabling it to pump blood more efficiently. It is important to note that the therapeutic applications of amlodipine extend beyond the management of high blood pressure alone. Doctors also frequently prescribe it to alleviate chest pain, a condition medically termed angina. Angina typically arises in individuals who have coronary artery disease, a condition where the arteries supplying the heart muscle with oxygenated blood become narrowed due to plaque buildup. By facilitating the relaxation and widening of these narrowed vessels, amlodipine ensures a more consistent and adequate supply of oxygen to the heart muscle, thereby reducing the frequency and intensity of chest pain experienced during physical exertion. Clinical guidelines established by prominent professional bodies, such as the American College of Cardiology and the American Heart Association, specifically recommend amlodipine as a primary or first-line treatment option. This recommendation is made with particular emphasis on its suitability for individuals over the age of 55. Furthermore, amlodipine has demonstrated notable efficacy in certain patient demographics, including older adults and individuals of African American descent, often proving more effective in these groups compared to some other classes of blood pressure medications. Now, let's turn our attention to the effectiveness of amlodipine. Clinical trials have consistently demonstrated its ability to lower blood pressure in a reliable and predictable manner. In one substantial study, participants who were taking amlodipine experienced an average reduction in their systolic blood pressure, which represents the higher number in a blood pressure reading, by approximately 16 points. To provide a comparative perspective, Losartan, a medication we will discuss in detail shortly, resulted in a reduction of around 14 points in systolic blood pressure within the same study. While this difference of 2 points may seem numerically small, it is crucial to recognize the profound impact it can have on a population level. Even a seemingly minor average drop of 2 points across millions of individuals can translate into thousands of fewer strokes and heart attacks occurring each year. This is precisely why healthcare professionals view amlodipine as an exceptionally powerful and valuable tool in the ongoing effort to control and manage high blood pressure effectively. However, the numbers displayed on a blood pressure monitor, while important, do not encapsulate the entirety of a patient's experience with medication. How an individual feels on a day-to-day basis is equally, if not more, significant. This is precisely where the discussion of side effects becomes critically important. The most commonly encountered adverse effect associated with amlodipine is swelling in the feet and ankles, a condition medically referred to as bilateral edema. This physiological response occurs because amlodipine effectively relaxes the arteries that are responsible for carrying blood away from the heart. However, the veins, which are tasked with returning blood to the heart, do not experience the same degree of relaxation. This disparity in vascular tone creates an imbalance, leading to the pooling of blood and excess fluid in the lower extremities. Over time, this accumulated fluid can then leak into the surrounding tissues, resulting in noticeable swelling of the ankles. If you have ever experienced the sensation of your shoes feeling progressively tighter as the day wears on, even without any significant changes in your body weight, this could very well be an indication of edema. The Cleveland Clinic has reported that approximately 1 in 10 individuals taking a standard 10 milligram dose of amlodipine will experience this swelling. The incidence of this side effect appears to be higher in women, and the risk generally increases with higher dosages and prolonged duration of treatment. Dizziness is another frequently reported complaint among patients taking amlodipine. This sensation can sometimes be attributed to orthostatic hypotension, which is characterized by a sudden and sometimes precipitous drop in blood pressure upon transitioning from a lying or seated position to standing up abruptly. Individuals experiencing this may describe feeling lightheaded or a sense of unsteadiness for a few seconds, particularly noticeable in the morning hours. Fatigue is also a side effect that some patients report. Certain individuals express feeling more tired than usual, even if their sleep patterns remain unchanged. Others describe a general sense of sluggishness that can impede the performance of routine daily activities. Less commonly, amlodipine can lead to mild nausea, discomfort in the stomach, or daytime drowsiness. While most of these side effects are not considered life-threatening, they can undoubtedly detract from a person's daily comfort and overall quality of life. It is not at all uncommon for patients to discuss these ongoing symptoms with their doctors and request a reduction in dosage or a change to a different medication altogether. When we take a broader perspective and consider the overall profile of amlodipine, it emerges as a medication that is both potent and reliable. It consistently lowers blood pressure, and for a significant number of individuals, it effectively manages their condition without introducing major disruptions to their daily lives. However, it is associated with a notably higher probability of experiencing ankle swelling, dizziness, and persistent tiredness when compared to certain other blood pressure medications. Moreover, the likelihood and intensity of these side effects tend to escalate in correlation with the prescribed dosage. Physicians carefully weigh these factors when making prescribing decisions. In some instances, a straightforward solution involves simply reducing the dosage of amlodipine. In other cases, a combination therapy where amlodipine is administered alongside a diuretic, a medication designed to help the body eliminate excess fluid, can effectively mitigate the issue of swelling and reduce fluid retention. When side effects persist and continue to cause significant discomfort, transitioning to a different class of blood pressure medication may indeed be the most beneficial course of action. So, to summarize our discussion on amlodipine, it is a highly effective and widely trusted medication, often serving as a first-line treatment for hypertension. However, for a subset of patients, it can present challenges due to bothersome swelling in the ankles or a pervasive feeling of fatigue. Now, let's shift our focus to losartan and conduct a comparative analysis of its side effect profile. Losartan belongs to a distinct group of medications known as angiotensin receptor blockers, or ARBs. These drugs operate through a different biochemical pathway compared to calcium channel blockers like amlodipine. Instead of directly relaxing the arteries, losartan functions by inhibiting the action of a natural hormone in the body called angiotensin II. This hormone plays a significant role in regulating blood pressure by constricting blood vessels and signaling the kidneys to retain salt and water, thereby increasing blood volume. By blocking the effects of angiotensin II, losartan effectively prevents this vasoconstriction, leading to more relaxed blood vessels. Additionally, it encourages the kidneys to excrete excess salt and water, further contributing to a reduction in blood pressure and alleviating the overall strain on the cardiovascular system. Losartan is not only prescribed for the management of high blood pressure, but is also frequently recommended for individuals with type 2 diabetes who have developed kidney disease. The reason for this recommendation lies in losartan's protective effect on the kidneys. By inhibiting angiotensin II, it helps to mitigate the damaging effects this hormone can have on the delicate structures of the kidneys over the long term. For patients who are simultaneously dealing with high blood pressure and diabetes, losartan can offer a dual benefit, simultaneously lowering blood pressure and slowing the progression of kidney complications. It is also utilized in the treatment of some patients experiencing heart failure. By reducing the pressure within the heart and the systemic circulation, it assists the heart in pumping blood more effectively and with less effort. Regarding its efficacy in lowering blood pressure, large-scale clinical studies have shown that losartan, on average, reduces systolic blood pressure by approximately 14 points. This is a slightly smaller reduction compared to amlodipine, which lowered systolic pressure by about 16 points in the same comparative studies. Nevertheless, this 14-point drop is considered a robust and clinically significant decrease. It is well established that even a reduction of 10 points in systolic blood pressure can lead to a substantial decrease in the risk of stroke and heart attack, often ranging from 20% to 30%. Therefore, in practical, real-world terms, losartan is highly effective in preventing the major life-threatening complications associated with uncontrolled high blood pressure. Where losartan truly distinguishes itself from amlodipine is in its side effect profile, particularly concerning peripheral edema. While amlodipine is widely recognized for its tendency to cause swelling in the feet and ankles, losartan is generally much kinder to the legs in this regard. In fact, swelling in the feet and ankles is a relatively rare occurrence with losartan. This characteristic makes it an excellent alternative for patients who find they cannot tolerate amlodipine due to issues with fluid retention. However, losartan is not without its own distinct set of potential side effects that patients should be aware of. The most commonly recognized side effect associated with losartan is a persistent dry cough. This phenomenon is thought to occur because the blockade of the angiotensin pathway by losartan can influence the activity of certain enzymes within the lungs. When the activity of these enzymes is disrupted, it can lead to a chronic irritation or tickle in the throat, manifesting as a persistent cough. For some individuals, this cough may be mild and easily managed. For others, however, it can be sufficiently bothersome to interfere with sleep and even impact social interactions and conversations. While not every patient who takes losartan will develop this cough, when it does manifest, switching to a different medication is frequently the only effective solution. Another, albeit rare, but potentially serious side effect of losartan is angioedema. This condition involves sudden and often severe swelling of the lips, tongue, face, or even the throat. While it does not occur frequently, when it does happen, it can compromise the airway, posing a life-threatening risk. Patients who develop angioedema while taking losartan must discontinue the medication immediately and seek emergency medical attention. The risk of angioedema is known to be higher in individuals who have previously experienced similar reactions to ACE inhibitors, another class of blood pressure medications. Dizziness is also a possible side effect, which is understandable given that losartan's primary action is to lower blood pressure. Some patients may experience lightheadedness, especially when changing postures, such as standing up too quickly. This is related to orthostatic hypotension, the same phenomenon that can occur with amlodipine. While this effect typically improves as the body adjusts to the medication, it can be particularly concerning in older adults who are already at an increased risk of falls. Fatigue is occasionally reported, with some individuals describing a mild increase in tiredness. Stomach upset, including symptoms like mild nausea, heartburn, or general abdominal discomfort, can also occur. In the majority of cases, these effects are temporary and tend to diminish as treatment continues. On the positive side, losartan possesses several unique therapeutic benefits. As previously mentioned, it offers significant kidney protection for individuals with diabetes, a fact supported by extensive research funded by the National Institutes of Health. It has also been shown to reduce the risk of stroke in certain high-risk patient populations. Importantly, unlike some other blood pressure medications, losartan generally does not tend to cause adverse effects on blood sugar levels or cholesterol profiles. When we consider the overall picture of losartan, it is widely regarded as one of the most well-tolerated blood pressure medications available on the market. It is significantly less likely than amlodipine to induce swelling in the legs, and it carries a lower risk of triggering a severe cough or angioedema compared to older ACE inhibitor medications. Nevertheless, no medication is entirely free from the possibility of side effects, and it is crucial for patients to remain vigilant and report any new symptoms they experience after starting losartan to their healthcare provider. In clinical practice, physicians often weigh several factors when deciding between prescribing amlodipine or losartan for a particular patient. If a patient already struggles with pre-existing ankle swelling or edema, losartan is frequently the preferred choice due to its lower propensity to exacerbate this issue. Similarly, if the primary concern is kidney protection, especially in individuals with diabetes, losartan is often the initial medication of choice. Conversely, if the immediate need is for rapid and potent blood pressure reduction, amlodipine might be considered the more powerful option. To summarize our findings on losartan, it effectively lowers blood pressure, offers crucial kidney protection, and is generally very well tolerated by most patients. Its most common drawback is the potential for a dry cough, and in very rare instances, the risk of angioedema. However, overall, it stands as a safe and effective long-term treatment option for a considerable number of individuals with high blood pressure. Now, let us bring together all the information we have gathered and directly compare amlodipine and losartan, providing a clear understanding of where each medication stands in relation to the other. We have now thoroughly examined both amlodipine and losartan individually. Both are widely used, both are effective in their primary purpose of lowering blood pressure, and both play a vital role in preventing serious cardiovascular events and saving lives. However, when viewed side by side, the distinctions between them become quite apparent. Let's begin by comparing their potency in reducing blood pressure. Amlodipine, as a calcium channel blocker, works by directly relaxing the arterial walls. Clinical trials have consistently shown that it can lower systolic blood pressure by an average of approximately 16 points. Losartan, on the other hand, operates as an angiotensin receptor blocker, and in similar studies, it has demonstrated an average reduction in systolic blood pressure of about 14 points. While this 2-point difference might not seem substantial on paper, it is crucial to remember the profound implications of even small variations in blood pressure management across vast patient populations. Even a mere 2-point difference in average systolic blood pressure reduction can translate into thousands fewer instances of stroke and heart attack annually. Therefore, in terms of raw blood pressure lowering capability, amlodipine possesses a slight yet statistically significant advantage. However, the efficacy of blood pressure reduction is only one part of the equation. The other, equally critical component is tolerability, how well patients can live with the medication on a day-to-day basis without experiencing disruptive side effects. This is where the treatment pathways for amlodipine and losartan diverge most noticeably. With amlodipine, the most frequently reported complaint is swelling in the feet and ankles. Approximately 1 in 10 individuals taking a standard dose will notice this swelling. For some, it might be a mild inconvenience, such as shoes feeling a bit snug by evening. For others, it can become uncomfortable, bothersome, and even discouraging, impacting their physical activity and daily comfort. Other side effects associated with amlodipine include dizziness, fatigue, and occasionally mild nausea or drowsiness. It's important to reiterate that the likelihood and severity of these effects often increase with higher dosages. Losartan, in contrast, generally offers a much more favorable profile concerning peripheral edema. It is significantly less likely to cause swelling in the legs, making it a highly attractive option for patients who have a history of edema or for older adults who are particularly concerned about fluid retention and its potential impact on circulation. However, losartan comes with its own set of trade-offs. The most common adverse effect associated with losartan is a persistent dry cough. While not everyone who takes losartan will develop this cough, when it does occur, it can be difficult to ignore and may significantly impact a patient's quality of life. Another risk, albeit rare, is angioedema, which involves sudden and potentially dangerous swelling of the lips, face, or throat. While infrequent, it is a serious condition that requires immediate medical attention. So, which drug is worse? The truthful answer is that it is entirely dependent on the individual patient. No two people react to medications in precisely the same way. Physicians meticulously assess a patient's entire medical profile before making a prescribing decision. For instance, if a patient has pre-existing kidney disease, particularly if it is linked to diabetes, losartan might be considered the superior choice. This is not only because it lowers blood pressure, but also because of its documented ability to offer long-term protection to the kidneys. If a patient experiences angina or requires a very rapid and robust reduction in blood pressure, amlodipine might be the preferred agent due to its potent vasodilatory effects. If ankle swelling is already a significant issue for a patient, losartan is often the safer and more comfortable choice. Conversely, if a patient has a history of severe allergic reactions, particularly to ACE inhibitors, physicians might opt to avoid losartan altogether and select a different medication. In clinical practice, it is also not uncommon for doctors to combine these medications. Pairing a calcium channel blocker like amlodipine with an angiotensin receptor blocker like losartan can achieve a powerful synergistic effect in controlling blood pressure while potentially mitigating some of the individual side effects associated with each drug. However, such combination therapies are complex decisions that can only be made by a qualified healthcare provider based on a comprehensive evaluation of the patient's overall health status and their complete medication history. The most critical takeaway from this comparison is that both amlodipine and losartan are highly effective medications that can significantly improve health outcomes and save lives. However, neither drug is perfect, and both come with their own unique set of potential side effects. Amlodipine is a powerful tool for blood pressure control, but carries a higher likelihood of causing swelling. Losartan is generally easier on the legs, but presents the risk of a cough and, rarely, angioedema. Ultimately, the most appropriate choice for any given individual is determined by their unique physiology, their specific health conditions, and the professional judgment of their doctor. What steps should you take if you are currently taking one of these medications? Firstly, and most importantly, never stop taking your medication abruptly without consulting your doctor. High blood pressure is often referred to as the silent killer for a very good reason. It can cause significant damage to your arteries over extended periods without obvious symptoms. Suddenly, discontinuing your medication can drastically increase your risk of experiencing a stroke or a heart attack. Secondly, it is imperative to listen to your body. If you notice any new or concerning symptoms such as swollen ankles, unusual fatigue, persistent dizziness, or a nagging cough, bring these to the attention of your doctor without delay. These side effects are real, and your doctor is equipped to make adjustments to your treatment plan to alleviate them. Thirdly, consistency in taking your medication is key. Blood pressure medications are most effective when taken at the same time each day. Skipping doses can lead to fluctuations in your blood pressure, diminishing the overall benefit of the treatment. Finally, always remember the broader context of your health. Lifestyle modifications continue to play a crucial role. Reducing your salt intake, engaging in regular physical activity, avoiding smoking, and maintaining a healthy body weight can all significantly enhance the effectiveness of your medication and, in some cases, may even reduce the dosage you require. In conclusion, we have thoroughly compared Amlodipine and Losartan. Both are instrumental in lowering blood pressure and can be life-saving interventions. However, their side effect profiles differ considerably. Understanding these differences can make a profound difference for you or someone you care about who is taking these medications. If you found this explanation helpful and informative, please consider giving this video a thumbs up, as it greatly assists in the growth and reach of our channel. And remember to subscribe to MedDose Explained for more clear, doctor-level explanations of the medications you take every day, ensuring you never miss our future breakdowns of essential side effect information. One final, crucial reminder: this video is intended for educational purposes only and should not be construed as medical advice. Always consult with your personal healthcare provider before making any decisions regarding your medication or treatment plan. Stay informed, stay healthy, and we look forward to seeing you in our next video.